We want Ascariasis. Ascaris. Only one the man is a host. Only one the man is a host. So it's infection of the small intestine. And Ascaris lumbricoides, the organism known as the Ascaris lumbricoid, the largest nematode of the human being in the human body. There is the largest. It is the largest nematodes, and also known as roundworm. So when we look, it is 80% found in the jejunum and 75% found in the ileum. So regarding transmission, it is like from the helminthes, and like when you look at the morphology, it is found in the three form. First in the adult form, then there is a larva form. Larva form has the 4 stages and the egg form. So when you look at the adult form is a cylindrical, 15 to 31 cm, and the female give to the two type of the egg. There is the fertilized egg and unfertilized egg. So when you look at the embryonated or mode of transmission, so it is ingestion by the embryonated egg. If the ingestion of mode of transmission is ingestion of the embryonated egg, so there is a soil. If from the soil, embryonated egg is ingested from the soil, water or food, and that embryonated egg migrate into the this embryonated ingestion. This is the infective stage. So embryonated egg is ingestion leads to the infection. So there is a migratory phase. So in the migratory phase, so L2 larva molted, and L2 larva molt from the L3 larva. L3 penetrated the small intestine. Through the small intestine is going into the portal vein through the right side right sided of heart, and after that right side have pump the blood into the lungs. So the pulmonary circulation going into the pulmonary circulation into the lungs, and after into the lungs through the pharynx is going into the pharynx, and after the pharynx in the pharynx and swelling into the stomach, and it's formed as a adult in the intestine. So this is the migratory phase of the Ascaris lumbricoid. And also we look in this image. So when men acquire the infection by the ingestion of contaminated whole embryonated egg, contamination food, soil and water with the embryonated egg, so that convert into the rhabdiform larva, and rhabdiform larva is a L2 larva, and it hatches from the egg out. It's just come out from the eggs and from the egg, and it start the molting, and the molting start that lead to the larva penetrate the, after the molting, that this larva penetrate to the small intestine. When the again we are repeating the same cycle. So here again go in the right side of the heart and go lungs, pharynx and swell into the small intestine. In the small intestine is converted into adult worm, and adult worm is converted into, and adult worm fertilization, there is a fertilization occur. So it laid two type of egg. One is the unembryonic egg and another is the embryonic egg. So this is unembryonic egg passes through the feces and go into the swell, and it is converted into embryonation. There is embryonation occurs, so embryonic egg, and this again the infect the other person, and same cycle occur. This is like cycle of the lumbricoids. So when you look at the intestinal phase, it is known as L4 larva. L4 larva go into final molting, and final molting from the adult worm. So after the adult worm, there is a female. So if the female molting adult worm is a molting, if the female is mating with the male, so it's converted into the unfertilized egg converted. If the mating occurs, so fertilized egg is formed. If the mating is not occur, then there is an unfertilized egg. So when you look at the gravid female lays 2.4 lakh per day eggs. A gravid female of the Ascaris lumbricoid which lay the 2.4 lakh of the egg per day. Regarding the development in the soil, after the fertilized egg come out in the soil and or the through the feces, and it start to melting, and there is two melting occur, and this is the embryonated egg. So it's converted into the converted, and there is a carrying of the L2 larva, embryonated carrying of the L2 larva. It is infective to the man. This L2 larva is infective to the man, so it survive in the soil like 15 years. There is a thick cell wall or lipopolysaccharide has the preserve and or the make it survive to the 15 years, and there is a resistance to the disinfectants. So disinfectants cannot destroy these eggs. For the suitable condition, there is a 2 week of the suitable condition. In the 2 week, it's like 22 to 30 degrees Celsius, and the clay soil or 40% of humidity, it is a suitable condition for this molting. So pathogenesis, when we first look the incubation period. Incubation period of this organism is the like 16 to 70 days. So it's initially, so it's also so earlier also so like the pulmonary symptoms, like when you go to the lungs there is a this apnea, dyspnea, or like the respiratory symptoms are also seen, respiratory product symptoms. So pathogenesis, when you look, it is caused by uh, pathogenesis caused by the lumbricoides causes. So there is a first immune response, migratory migration of larva, and also there is a mechanical obstruction of the adult worm, or regarding there is like nutritional deficiency to the adult worm, due to the adult worm. So regarding the pulmonary phase, we have also discussed intestinal phase. Now we are in the pulmonary phase. Immune-mediated hypersensitivity reaction is seen, and also second week of the ingestion of the egg, there is no productive cough, chest discomfort are seen, non-productive cough or the chest discomfort fever are seen. So there is a like Loeffler syndrome. This is known as in the pulmonary phase. There is a like eosinophilic pneumonia seen. So eosinophilic pneumonia or there is a dyspnea seen. This syndrome is known as Loeffler syndrome. Due to this Ascaris lumbricoides, there is a eosinophilia in the pneumonia, and that lead to the like Loeffler syndrome. In the intestinal phase, there are some symptoms like asymptomatics, or maybe asymptomatics, or malnutrition or growth retardation occur if the children is less than 5 years. And there is intestinal constipation, like there is a number of the more number of the Ascaris lumbricoides, so that leads to obstruction, or rarely, or there is a rarely perforation, like if the obstruction occur in the small intestine, so it's perforate. Also Ascaris lead to the perforate of the small intestinal wall. And there is an extraintestinal complication like cholecystis and cholecystic pancreatitis, or intrapancreatic abscesses. Intrahepatic abscesses. So like cholecystis, like there is obstruction of the bile duct, or there is like also obstruction of the pancreatic duct, that lead to the like pancreatic juice inside the pancreatic juice obstruction inside the pancreatitis. So there is a pancreatitis occur, or acute inflammation of pancreatitis. That is an intrahepatic abscess. Like if the blockage of the common hepatic duct or the other duct which open in the like a small intestine, so that lead to the intrahepatic abscesses, or this organism pass through the duct into in the liver, and that lead to the intrahepatic abscesses. There is also allergic manifestation like fever, urticaria, or angioneuritic edema. Regarding the lab diagnosis, detection of the parasite by the egg detection, swell examination, or sedimentation method, microscopy, or floating method, or the stool concentration. Adult worm, regarding the adult detection, stool or sputum, or barium meal X-ray. We also seen from barium mixture there is obstruction occur going on. There is like we can see this adult form of the Ascaris lumbricoides, and there is ultrasound or the cholangiopancreatography that help to the detection of this adult worm. Regarding the larva detection, there is the early pulmonary migration phase, so the found in the sputum gastric aspirates. Regarding the serology, also antibody detected by the ELISA are not used recently due to the seroepidemiological, like everyone has presented this type of the antibody. When you look at the egg, there is a like mammillated albuminous cut of the egg, and the unsegmented ovum. There is an unsegmented ovum. Then the crescentric shape of space. This is a fertilized corticated eggs. This is a fertilized corticated eggs. In the fertilized corticated, there is mammillated albuminous coat. There is an unsegmented ovum, and also crescentric space. Regarding the atrophic ovum or the unfertilized ovum, this is unfertilized ovum. There is an atrophic ovum, and also decorticated fertilized ovum. This is a decorticated. Without decorticated means that there is no corticated part. When you look at the molecular method, there is also PCR used for the international transcriptional space region. So cytochrome oxidase 1, and also real-time PCR for the qualitative. These are other method there is eosinophilia long stage, or the cyclotledin crystal present in the like if there is a Landen crystal deposition. This is a cyclotledin crystal. So due to this eosinophilia, this eosinophilic pneumonia that leads to Loeffler syndrome. So regarding the treatment, when you look at the treatment, there is albendazole 400 mg, or the mebendazole 100 mg BT for the 3 days, or the strong or the 500 mg once metronidazole. There is also alternative to like ivermectin or nitoxamide, nitoxamides. And the pregnancy, if the pregnancy have this Ascaris lumbricoides, so the quintal pamoids are given. Regarding the anti-helminthics, we will discuss in the another video.